Good morning, students. Today we will learn about the topic of the obstetrical and midwifery nursing. In that, we already started the unit first, that is the introduction of the obstetric and midwifery nursing. Okay, so we stopped by the we already learned about the introduction, key terms, what is the concept of the midwifery and obstetrical nursing, and also current trend and issue. Have what are the current trend and issue in the obstetrical and midwifery nursing. Today, further move on, we will see about the historical perspective, means how the obstetric and midwifery nursing is the developing day by day. So in the ancient time, that is a different kind of development, but nowadays very technology and very development is occurs and takes place in the obstetrical and midwifery nursing. So first of all, midwifery is as old as the history of the human species. Archaeological evidence of the woman squatting in children supported by the another woman from behind demonstrated the existence of the midwifery in 5000 before century. Okay, so before 5000 century, the midwifery is as old as the human species. Okay, the history of the midwifery is very old, and then Hippocrates comes, and the father, he known as the father of the scientific medicine. So organize, train and supervise midwives. Okay, so who is the father of scientific medicine? That is Hippocrates is the father of the scientific medicine, and he organized the train and supervise the midwife. Okay, what he done, that is the organize the train and supervise midwife, and then he believed that the fetus had to fight its way out of the womb and the membrane also, and the efforts of the Hippocrates were not appreciated by the midwife. Means Hippocrates done many development but not appreciated by the midwife. Okay, and that's why he can't develop the more thing, because he believed that the fetus had to fight us its way out of the womb also and membrane. But no one appreciated him. Okay. Then Aristotle comes. Aristotle is known as the father of embryology. He described the uterus and the female pelvic organs. He also discussed the essential qualities of the midwife. Okay. So Aristotle is known as a father of the embryology, and he described the uterus and female pelvic organ. He also discussed about the qualities of the midwife, essential qualities of the midwife, how midwife have to done and perform her duties. Next one, Soranus in the 2nd century was the first to specialize in obstetrical and gynecology. Soranus came in 2nd century, and he done that the specialize in obstetrical and the gynecology. His book was used for the 1.500 years. Okay, so his book is very essential and give very knowledge and use for the 1.500 years. He used a vaginal speculum advice on cord care and wet nursing. Okay, so he first use of the vaginal speculum is done by the Soranus, and also advice for the vaginal speculum is used for cord care and the wet nursing. Then Leonardo da Vinci in 1452 to 1519 made anatomical drawing of the pregnant uterus. Who made the drawing of the pregnant uterus? You may ask in an exam. So this whole history not on description form you may ask, but that is important for the objective question. Okay, so Leonardo da Vinci made a drawing of the pregnant uterus. Then Vesalius in 1543 opened the full-term pregnant uterus on a lower animal and extracted the fetus and demonstrated uterus as a single chamber organ. So when Leonardo da Vinci drawings a pregnant uterus, but the Vesalius described as a uterus as a single chamber organ. Then Ambroise Paré laid the foundation of the modern obstetric, and he performed the internal podalic version and skillfully delivered the woman. Okay, so Ambroise Paré is skillfully deliver a woman, and also he performed that the internal podalic version, because this kind of the version are important for the high risk pregnancy, breech presentation, malpresentation. Okay, so in that cases the version is very important. He was the first to deliver a woman in bed instead of the birthing stool, because in previous time the delivery of the woman is done into the birthing stool, but the embryos pare was the first that he delivered a woman in a bed instead of the birthing stool. And he also sutured a perineal lacration. Ambroise Paré founded a school for midwifery trained by Paré and attended the ladies of the French court. In he also firstly sutured the perineal laceration and tear, which may affect to the woman and may infect it to the woman in internal organ. So first time he sutured the perineal laceration, and he also founded a school for the specially midwife trained by the Pare and also attending the ladies of the French court. In short, the embryos Pare occur many development in that time. Okay. Then come Jewish Caesar Aranzi wrote the first book for the Italian midwife, which reigned by 17th edition, and he advised the cesarean section for the contracted pelvis. So first advice for the cesarean section by the Jewish Kaiser Aranzi. Okay, for what? That is contracted pelvis. It is a kind of the high risk in pregnancy and malposition of the pelvis. He described the raw placental surface and initiated the study of the uterine sepsis. Okay. Next, the French King Louis in 1663 employed a Paris surgeon and to attend the one of his mistress in labor, and pleased with the result of the king honored the surgeon with the little echo uterus. Means that the meaning of the echo uterus means a person who is assisting woman into the childbirth. So while woman delivering a baby or childbirth, that is the assistant was there. So the person who assists in that process is known as uterus. Okay. So Maurice in 1668 published the treatise as an midwifery, and Chamberlain in 1675 designed an obstetric forceps. This kind of question may you ask in exam, that is who designed the obstetric forceps, who designed the drawing of the first uterus. Okay, so Chamberlain in 1675 designed the obstetric forceps. Then William Smalley is called as the father of the British midwifery, and he explained the labor to be mechanical process and described the pelvimetry, cephalometry, and forceps delivery of the after coming head of the breech. Because in breech delivery, that is the position of baby is abnormal, not that much normal into the normal cases, right? Means in normal position of the baby, head is the come first, but in breech presentation maybe leg is there or chin is there, so that is called as a breech presentation or malpresentation. So in that case, he described the pelvimetry, cephalometry or forceps delivery. The chair of the midwifery was founded in 1726 in University of the Edinburgh, and the John Leake replaced the obstetric stool by the special delivery beds. Okay, the Charles White in 1773 stated that the puerperal fever was the infectious, and he used lime as a disinfected and clean linen, isolation, adequate ventilation, and sitting posture to facilitate the drainage. Yes, this is the most common complication after we can find it into the postnatal period. Okay, because in postnatal period, if women have any placental beads inside the internal organs, then it can may lead to the infection. So puerperal fever due to that infection is occur, and he used the disinfectant and clean linen and isolation for that, ventilation for the facilitated drainage. Next one is a feeding out. Describe the mechanism of the normal labor and perform the first episiotomy. This is the mainly asked who performed the first episiotomy. So feeding out 7010 to 7089. Okay. Next, the Gordon in 1795 described the puerperal sepsis as a wound contamination of the placental period. Okay, so as I told earlier, in after the postnatal period, that are so many complications is occur to the woman and affect to the woman health. So Gordon in 1795 described the puerperal sepsis means infection as a wound contamination. Okay, Then Leonek in 1860 invented a stethoscope. Then Francois in 1880 first recognized the fetal heart sounds in the pregnant uterus. Okay, so who recognized the first fetal heart sound in the pregnant uterus? That is the Francois in 1880. 1818. Okay, so James Young in Simpson in 1847 used the chloroform first in the obstetric for the anesthesia. So chloroform is used for the as a anesthesia is founded by the James Young Simpson in 1847. Then Florence Nightingale in 1862 organized a small training school in the connection with the King's College Hospital, where she conducted a training for the midwife. Okay, so Florence Nightingale done many development, that is in 1862. She organized small training school for the specially midwife and connected with the King's College Hospital also, where the midwife can train and gain more knowledge for the practical based also. So Samuel Wells in 1861 demonstrated the cause of the puerperal sepsis and suggested the preventive measures, because postnatal complications are more and more affected to the woman's health and also to baby. So in that case, he demonstrated the cause of the puerperal sepsis, that is infection, and prevention of that measure or infection. Then Louis Pasteur in 1879 wrote a thesis on the puerperal sepsis and demonstrating the presence of the streptococci in lochia, blood, and in fetal cases in the peritoneal cavity. Then Spencer and Valentine promoted the concept of the antenatal care for the pregnant woman, and Franz Morisiu, a French obstetrician, first reported the cesarean section in 1668. This question you may ask in the exam. That is the Franz Morisiu, a French obstetrician, first reported the cesarean section in 1668. Next one is a Poirot performed the subtotal hysterectomy. Hysterectomy means the removal of the uterus. Okay, so subtotal hysterectomy means whole removal of the uterus, performed by the Poirot in 1876, and the Max Sanger in 1882 first sutured the uterine walls, and in 1912 Cronin introduced the lower segment vertical incision, and it was popularized by the D. Lee in 1922. Means after the 10 year, the lower segment vertical incision is popularized by D. Lee. And Munro Kerr in 1926 introduced the present technique of the lower segment cesarean operation and popularized it. So this is the whole history of the midwifery and obstetrical nursing. How the midwifery and obstetrical is developed day by day. This all the description of that history. Okay. So next one is the role of the midwife. So how the midwife duty for the woman and newborn baby. Okay. So a midwife must be able to give the necessary supervision, care, and advice to the woman during the pregnancy, labor, and postpartum period. Not only the antenatal care or postnatal care or intranatal care. A midwife role is a mainly in whole pregnancy phase and after the delivery of the baby also. So she or he may necessary the supervision, care, and advice to a woman during pregnancy, labor, and also in postpartum period. They should be able to also to conduct the delivery on her own responsibility and to take care for the newborn and the infant also. So how the she care and responsible for the newborn care also. So there include the preventive measures, detection of the abnormal condition in mother and baby also, then procurement of the medical assistant and execution of the emergency measures in absence of medical help. This kind of the care included into the midwife role. Okay, so midwife have to done the preventive measure, detection of the abnormal condition of the mother and baby, then medical services is done or not. In case if any emergency is there, then absence of medical help, she have to be present there and role maintain that role and give the care, quality of the care to the patient. Okay, then she performs an important task of the counseling and education, not only for the woman but also within the family and community. Okay, so The midwife have important task of the counseling and education, because in previously time not woman is convenient for their point of view, but family members and some rituals due to that woman is embarrassed, and the not all practice is done. So in that case, guidance, counseling and education is must. So as a midwife, she performed that role also within the family and community. She may practice in hospital, clinic, health unit and domiciliary condition, or any other services. Okay, and the treat complication due to the miscarriage and unsafe abortion. The work should involve the antenatal education, preparation of the parenthood, extent of the certain areas of the gynecology, family planning, and childcare. Okay, because in community this kind of the topic is very important, because all people are not understand the this thing like the family planning, then health education related to woman and newborn care, preparation for the parenthood, how to prepare a parent for the responsible for her baby or their baby. Okay, so this kind of the topic is very important for the community people and relatives of the woman. So recognizing and addressing problems in woman and newborn before, during and after the childbirth, and offering the general health information including the reproductive health care and planning, then assisting woman to successfully breastfeeding, because mm, if woman has a conceive first pregnancy and delivering the first child, then the whole experience is new, totally new for the woman and newborn. So in that case, the woman has no experience of the breastfeeding or any other care of the newborn. So in that case, midwife have to care and assist the woman for the breastfeeding and any other care also. Referring a woman and newborn for higher level of the care where the complication arise and beyond the scope of the practice and capability. The principal objective of the midwifery profession is okay. So if the more if high complication arise to the woman or newborn baby, then in that case we suggested the higher level of the care at the other center also. Each midwife should uphold the dignity and honors of the profession and accept its self-imposed discipline. Midwife provide quality and culturally acceptable care to help keep women and newborn safe. So each midwife have to right of the dignity and maintain the professionalism in this kind of the care. Okay, so self-imposed discipline is maintained, quality of the care is given. Okay, so for the safe, keep a woman and newborn safe. In countries with the strong midwifery services, midwives play a very important role for the preventive measure and offering the immunization, health education, family planning, promotion of the many aspects of the health lifestyle. Okay, in this kind of the this is very serious topic for the woman health, because if we done any wrong thing with the woman, then whole life she have to suffer. So we have to properly guide and counseling the family related to immunization, health education, and health lifestyle of the woman and newborn baby care, family planning, etc. Midwives can also foster a dialogue with the female community leaders about the needs of the pregnant woman and way of the mobilizing support for them. Although TBS do not have the training to deal with the life-threatening condition, their cooperation can be very helpful in convincing the families of the benefit of the professional care, early referral, institute delivery when the complication arise or seem likely. As I told earlier, if life-threatening problems may arise, we can suggest to them for the higher level of the care is given to the mother as well as the newborn baby. So this is the main important role of the midwife. So by here I will stop this session. If you have any doubt, you can ask me. Okay. So this is the today we learn about the role of the midwife and historical development of the obstetrical and midwifery nursing. Okay. Thank you.